There's an understanding these rare forms exist. I have a very special perspective on kind of zebra diagnoses, if you will, these kind of rare diagnoses, because I've had a zebra diagnosis myself, not related to the breast, that was missed for many years. And my feeling as a clinician is a little more complex because I've been on both sides of that zebra diagnosis. I have been the one struggling and being missed, but I've also been on the other side of being the clinician who's trying to catch these zebras, but also not trying to give a false positive rate or fear of that. When you have a rare disease, we can know that they exist and understand they exist and have
Right.
it on our radar. But when it's so rare and you can go 13 years into my career plus 4+ years of training. So I am 17 to 18 years plus into my exposure to all of this. The number of cases of that I have seen, I can count on one hand. And so that is where some lack of experience, just because it's a rare disease, is an issue. It makes it more cloudy for us to be able to see that and to recognize it. So it is a harder diagnosis as clinicians for
Mm,
us to make. But I also agree that yes, we need to keep that in our differential diagnosis. We need to be more aware of kind of some of the simple and subtle changes we can pick up on that. In my experience as a zebra sort of diagnosis is I know this is different for every single patient, so I will speak for myself. I, in retrospect, don't necessarily feel that I was missed in a harmful way. I feel that my zebra diagnosis just wasn't found, which I think is just a different perspective to take. And it kind of was a perspective that gave me a little bit of solace. It's hard to miss a rare diagnosis that's a needle in a haystack. You just didn't find it. And those are two just different ways of kind of me as a clinician reconciling those challenges as a clinician of not being able to find something versus straight out missing something. If I miss something common, that is a much more egregious thing if I just can't find something that's rare that I'm looking for. We're out there looking and doing all of our due diligence and following our recommendations on all of this and trying so hard to find something. If I can't find it, that becomes a hard thing for both of us. But to me, that's not as, I should say, egregious as missing something common. And that's a
sure.
hard place to be in as a
Yeah.
clinician and as a patient. So, yes, we need more education. We need to understand what we need to look for. We need to
Yes.
continue to talk about it and to teach about it. But as a clinician, I've also given a lot of clinicians a lot more grace since my own diagnoses.